you today? Good. I'm going to go ahead and set this curtain for privacy. My name's Sabrina. I'll be your student nurse today. Could you state your name and date of birth for me? Thank you. Okay, go ahead and identify that on your wristband. Okay, everything checks out. So today I'm going to be performing a nasogastric insertion and a tube feeding because your physician did order that for you. The procedure could be a little bit, you could experience a little bit of discomfort, but I'll be here with you through the entire time and it should go very well. So, do you have any allergies I need to be aware of? No, okay, and are you in any pain at all today? No. Okay, so I'm going to go ahead and lift your bed to a comfortable height. Okay, so I'm going to first begin by doing an abdominal assessment. Just to make sure everything is okay before I start the procedure. So I'm going to go ahead and lift your gown up. First things first, I'm just going to check, make sure that it is non-distended, that the color is appropriate for ethnicity, and everything does look good. I'm going to go ahead and assess your bowel sounds. Okay, you do have hypoactive bowel sounds. That is okay. That is why we are doing the nasogastric insertion. And then lastly, I'm going to palpate just to make sure you don't have any pain anywhere. So let me know if you feel any pain or tenderness as I push on your stomach. Any pain? No. Okay, good. So I'm going to put your gown back down and we can go ahead and start the procedure. So we go ahead and put you in a high Fowler's position because that prevents aspiration. Okay. So like I said before, you could experience a little bit of discomfort, but I will be here the entire time, and if you experience any signs of difficulty breathing, I will stop the procedure, and during the procedure, once I do hit your throat, you will cough a little bit just because it stimulates the gag reflex, but I will pause, and then I'm going to have you take a sip of water while I am inserting it, and as you swallow, I will insert it all the way down. Do you have any questions before I get started? No? Okay. Go ahead and put my gloves on. Okay, so I'm going to go ahead and open the single lumen tube. So first things first is I'm going to measure this so I know how far to put it down. Okay. I'm going to measure it by placing it at the tip of your nostril to your ear and all the way down to your xiphoid process, which is right about here. So I'm going to go ahead and tape that so I know how far to go down. Okay, so now I'm going to put 2 to 4 inches of lube onto the nasogastric tube, just so it's easier to get down. Okay. So now I'm just going to have you tilt your head back. And I'm going to put it in your nostril that you can breathe out the most. So which one would that be? Your right one. Okay, so if you just breathe deeply for me, I'm going to push it upward and backwards. So in this case, the patient coughed because it stimulated his gag reflex. That also shows that it is in his pharynx. So I'm going to have the patient tilt his head from his chin to his chest, and I'm going to have him sip on some water. So as he's swallowing, I can push it down more. Okay, and so in these mannequins, you can't push it down as far as it's supposed to go, but in a real life scenario, you would put it all the way down to where the tape is. So now that it's inserted, I'm going to go ahead and just tape it lightly onto the patient's chin, just because I can't fully tape it onto his nose yet because I have to confirm that the placement is accurate. So you have to confirm this 2 of 4 ways. The first way is you can have the primary care provider order an x-ray. The next way is to aspirate the gastric contents to make sure that gastric contents do come out, so I'll go ahead and do that. So you would aspirate a little bit of the contents. So if gastric contents do come out, you can unclip this. You want to clamp it so it doesn't go back in. You'd unclip it, and then you could pour it into something like a solution or a basin, anything like that. And you would want to check the pH. And if it is below 5.5, that means it is in your gastric area, so it would be in the right position. So you could throw that away. That could be another way. And then another way is you could check for the color and the consistency. So if it was in your bowel area, it would be like greenish, like with particles, or it could be brownish if there's blood I guess, and then also it could be a little bit whitish. But you can also measure just to make sure where the tape went. If the tape is where at the end of the nose, that means that it is also in the right area. So if you do 2 of the 4 ways and they both work out, that means that it is in the right placement. And so you can go ahead and tape it to the patient. So what you want to do is you want to grab about 4 inches of tape. And you want to have the bottom 2 inches cut so you can wrap it around the nasogastric tube. Okay, and then you want to put one across the bridge of the nose as well. It's secure, you can go ahead and put the patient on suction if the order requires it. You want to make sure that the suction goes no higher than 150. You want it to be between 120 and 125, so we'll check that. A little bit lower. So you can put that in the tube. And lastly, what you want to do is you want to measure to see where the nasogastric tube is, or how much length is left out of the body, just because for future confirmation and checking to make sure that the placement is well before you perform other procedures with the nasogastric tube, you want to make sure it is in the right place. So you would go ahead and measure that. You just straighten it out, measure it by using a measuring tape. And then after that, you're good to go. So in the case of this video, we're also supposed to do a tube feeding, which we can do that, so we'll do that as well. You would go back in, close the curtain for privacy, have the patient state his name and date of birth, perform hand hygiene again, and you would explain the procedure to the patient. So the physician has ordered a tube feeding to the patient, and you would explain to him that the procedure, just that you're going to be putting tube feeding down the nasogastric tube using a syringe and answer any questions that the patient may have. You would also want to perform an abdominal assessment before. In this case, I did it at the beginning of this video, so I'm not going to do that. But in a real life situation, if you came back in to administer a feeding, you would want to do another abdominal assessment just to see, to make sure they're not distended, and to listen to their bowel sounds and things like that. So first thing is first, you would check solution for the expiration date and the right solution for the patient, because we will be irrigating as well during this procedure. And so the expiration date looks good. And then for the tube feeding, you would want to check the amount, the concentration, the frequency, and all of that type of stuff for the patient before you administer it as well. So now that the solution and the feeding tube, the feeding solution is up to date and it's not expired, anything like that, we're going to go ahead and start the procedure. So after we did the abdominal assessment, like I said, we would have to check the placement again. I've already done that for the first part of this video. So what you would do is you could either measure, you would first start off by measuring with the measuring tape to make sure that the length of the tube out is the same that you recorded earlier. And then you could also aspirate gastric contents and check the pH. And then you could also check the color and the consistency to make sure it was normal for it to be in the right place. So after I do all of that, we can go ahead and start the procedure. You want to go ahead and take the suction off. Go ahead and turn that off. Put some more gloves on. And before administering any of the feeding, you want to make sure your hands are clean. You have gloves on, you have like brand new hand hygiene, just because it is food that's going into his body. Get these gloves on. Ask the patient if he's okay still. These gloves just broke, so we're going to put some new ones on. Okay. So once again, I would tell the patient that if he was feeling any signs of difficulty breathing, anything like that, I would stop the feeding, and I'd want to observe the entire time just to see his response to the food during the procedure and after. So in this case, we'll be doing a tube feeding through a syringe. Okay. So after everything has been confirmed, we want to go ahead and aspirate the gastric contents that are in the patient's stomach from the previous tube feeding. So you would grab a clean syringe, you would pull all of the gastric contents out that the patient has. And if it is over 200 to 250 milliliters, you will not be able to do another tube feeding. In this case, it is not over 200 to 250 milliliters, so I am able to continue. And then you're going to go ahead and put all those gastric contents back into the patient's stomach. Okay, and so then you want to clamp it before you take it off, and then take it off and throw this away. And then next, you're going to grab 30 to 50 milliliters of solution water, just regular water, to irrigate, just to clean everything out after getting all those gastric contents. So you would take it, you would push it, I can't put this in the mannequin, but you would push 30 to 50 milliliters of water into the nasogastric tube and let that go through. Once again, you would clamp it and then take it off. And then you would start to administer the food. So first things first is you would open up feeding the solution. And you're going to take the plunger of the syringe out, and you're going to start by, you first want to put the syringe in there in case there's any leakage, and then you're going to start by pouring the acquired amount of food that the provider has prescribed. And so once that is in, you're going to go ahead and put the plunger back in. You kind of want to lift it a little bit high, not too high, probably 8 to 12 inches. And so you're going to kind of let it, you don't want to push the food in, you just want it to go through by gravity. So you would wait until all the food is administered. So once the food is administered, you're going to clamp it and take it off. And then you're also going to irrigate with 30 to 50 milliliters of solution again. So I would get 30 to 50 milliliters of solution, not solution, water, I'm sorry, and then put it back in the patient. And then you're gonna clean the patient with water just to make sure everything's clear. And you're gonna clamp it and take it off. And then you would hook the patient back up to suction. Observe just to make sure there's no abnormal responses from him after the tube feeding. And you would want to perform oral hygiene for the patient, just because after giving him a tube feeding, that's what you would want to do. And then you would want to keep the patient in a high Fowler's position for an hour after they have eaten, but you could put the bed into the lowest possible position, ask the patient if he needed anything else, and if he didn't, the procedure is over.